Hi, I am Dr. T.S. Roy from New Delhi. Today I will discuss about the vestibulo-ocular reflex. In this video, I am going to discuss what is vestibulo-ocular reflex or VOR, then VOR in normal or physiological condition and VOR in comatose person. Let us identify some of the parts of the internal ear where our vestibular organs are present. Here it is showing the lateral view of a person with the external ear, and this is the internal ear with its cochlea anteriorly and the semicircular canals posteriorly. In the middle part is the vestibule from where the vestibular nerve comes out, and here is the vestibular ganglion. Vestibular nerve joins with the cochlear nerve, and along with the facial nerve it enters into the internal ear. Inside the bony labyrinth lies the membranous labyrinth. The three semicircular canals are there, and between the bone and the canal and the membrane of the canal there lies perilymph, and inside the canal lies the jelly like substance called the endolymph. Here are the dilatations in the semicircular canal, and these dilatations are called ampulla, and the semicircular canal opens into this structure which is called utricle. Here is the base of the skull showing the exact position of the internal ear: anteriorly cochlea, posteriorly semicircular canal. There are three semicircular canals: anterior, horizontal and the posterior. Bony and membranous labyrinth. The bony labyrinth is present in the internal ear. We get sensory information from the vestibule and the semicircular canals of the labyrinth in the internal ear. The static labyrinth is represented by the utricle and saccule, which detects the position of the head with respect to the gravity. The kinetic labyrinth represented by the semicircular ducts, and it detects the movement of the head. Both parts of the membranous and membranous labyrinth serves to maintain the equilibrium. The kinetic labyrinth has a special role in coordination of the eye movements with the rotation of the head. In the semicircular canals there is the dilatation. This dilatation is called ampulla, and there is a crest like elevations inside the ampulla. This is called crista ampullaris, and on the crista ampullaris are the hair cells. The hair cells are the sensory cells in the semicircular canal, and on the top of the hair cells there are cilia. The cilia are embedded in a cap like structure called the cupola. When the head moves towards the right side, the semicircular canal also moves, but at the same time endolymph does not move. Endolymph moves to the opposite side and it moves the cupola. So, along with the cupola, the hair cells also move, and this movement causes or generates or electric current. When the head is rotated to the left side and gaze is fixed, what is happening? My eyes are moving towards the opposite side. How it happens? This is vestibulo-ocular reflex. So, in the vestibule, what we have? We have the sensory receptors or the hair cells. The hair cells of the left side, when I am moving the eye towards the left side, the endolymph is moving to the opposite side. The same is happening to the right side. The endolymph is moving to the opposite side. From the base of the hair cells, the nerve fibers are coming and it forms the vestibular nerve. Here is the ganglion of the vestibular nerve, which is called Scarpa's ganglion. So, in details, this is the cupola and these are the hair cells. The movement of the cupola distorts the hairs or the cilia towards the opposite side, and that distortion causes or it produces depolarization in the hair cells. The distortion changes the membrane potential, altering the synaptic transmission between the cells and the sensory neurons that innervate them. The signals from these vestibular neurons convey information to the brainstem. How is the axon potential is generated? On the top of the hair cells, there are cilia. These are the stereocilia. One of the cilium is called kinocilium, and the other cilia are smaller. When there is movement of the endolimb, the smaller cilia moves towards the kinocilium and it produces depolarization. In the opposite side, the smaller cilia goes away from the kinocilium. So, what is happening? It produces hyperpolarization or inhibition. Generation of the action potential. Here it shows the one of the hair cell, and from the top of the hair cell, these are the cilia. One of the cilia which is larger is called the kinocilia. The smaller cilia are the stereocilia. When they are moved by the endolimb, the smaller cilia moves towards the kinocilia and there are tip links. Those tip links open and there is entry of potassium ion and the calcium ion, which produces depolarization or excitation, and cilia moves away from the kinocilium, it produces hyperpolarization and inhibition. Or axons of the vestibular nerve, after entering the brainstem, it relays into the vestibular nucleus, which has 4 components: superior, medial, lateral and inferior. The fibers from the semicircular canal, they relay into the superior nucleus and the medial nucleus. In the brainstem, there is a midline white fiber connecting the 3rd, 4th and 6th nerve nuclei, which supply the extraocular muscles for the fibers from the vestibular nucleus. They join the medial longitudinal fasciculus and see the position of the 3 nucleus. The oculomotor nucleus lies in the midbrain, and also the trochlear nucleus, which is 4th nerve, also lies in the midbrain, and the abducens nerve nucleus lies in the pons. The vestibular nerve nucleus is present both in the upper part of the medulla and the lower part of the pons. Here it is showing the details of the 4 parts of the vestibular nucleus. Before going to the movement of the eyeball, let us identify some of the features of the extraocular muscles. This is showing the lateral side of the eye. This is the lateral rectus. When the lateral rectus contracts, the eyes will move towards the lateral side. This is showing the recti muscle from the superior side. This is the superior rectus. When the superior rectus contracts, the eyeball move towards the up. This is the medial rectus. When the medial rectus contracts, the eye will move towards the medial side. So, what is vestibulo-ocular reflex? See, when the head is moved, along with the movement of the head, there is movement of the endolimb to the opposite side, and the movement of the endolimb distorts the hair cells. There is production of axon potential. The fibers of the vestibular nerve, they relays into the superior and medial vestibular nucleus. From the medial vestibular nucleus, fiber cross the midline through the medial longitudinal fasciculus and relay into the abducens nerve nucleus. The abducens nerve supplies the lateral rectus of the same side. So, if it is stimulated, then what will happen? The eye will move towards the lateral side. At the same time, fibers from the abducens nucleus cross the opposite side and relay into the oculomotor nerve nucleus. Then oculomotor nucleus supplies the medial rectus. So, these are the excitatory fibers. This excitation will cause contraction of the medial rectus. So, there is contraction of the medial rectus of the left side and contraction of the lateral rectus of the right side. what will happen? There will be deviation of the eyeball towards the right side. So, similarly, what is happening to the opposite side? In the opposite side, there is inhibition, because the cilia goes away from the kinocilium and it produces hyperpolarization, which produces inhibitory action potential, which inhibits the sixth nerve or lateral rectus of the same side and the third nerve or the medial rectus of the opposite side. So, there will be contralateral relaxation of the eyeball at the same time. So, the neural pathway, the vestibular impulses caused by motion of the head that contribute to the appropriate movements of the eyes and maintain the fixation of an object in the visual field. When you want to see something in front of our eyes and when we are rotating our head, at that time our head is rotating and eyes are rotating to the opposite side. This is vestibulo-ocular reflex. So, just like any other reflex, it has a receptor. What is the receptor? Receptor are the hair cells. Those hair cells are distorted and depolarization or the action potential comes to the vestibular nucleus. From the vestibular nucleus, it goes to the abducens nucleus of the same side and the opposite side. Abducens nucleus is connected to the oculomotor nucleus and the excitatory fibers or excitation goes to the lateral rectus of the opposite side and the medial rectus of the same side. Similarly, it happens to the other side also. So, there is inhibition of the vestibular nucleus and the inhibition of the abducens nucleus. Abducens nerve supplies the lateral rectus. So, there is inhibition or relaxation of the lateral rectus. At the same time, fibers from the abducens nucleus passes through the medial longitudinal fasciculus and it supplies the third nerve, supplies the medial rectus. So, at the same time, one side medial rectus relax and opposite side lateral rectus contracts. So, during conjugate deviation, what is happening? There is sudden jerky movement of the eyeball. This is called nystagmus. The sudden jerky movement occurs at the same time. It has a slow component and it has a fast component. It is sudden jerky movement of the eyeball during conjugate movement. It has two phases. The last phase during the return to normal position is the quick phase. That's what is the application of this vestibulo-ocular reflex and caloric test. The caloric test detects the integrity of the vestibulo-ocular reflex or the fibers coming from the cerebral cortex. In the caloric test, what is done? The patient is put in such a position that their horizontal semicircular canal lies in a vertical plane and cold water or the hot water is put in the external ear. So, what it does? It either increases or reduces the viscosity of the endolimb and as a result there is either stimulation or depression of the vestibular nerve. So, this is showing the normal vestibulo-ocular reflex. When the cold water is put on the right side, there is conjugate deviation of the eyeball to the right side and of the vice versa this happens to the left side. When the hot water is put or warm water is put, just opposite happens. The conjugate deviation is on the opposite side. The conjugate deviation is absent if the vestibulo-ocular pathway is interrupted and this nystagmus also the faster component also or the quick component also disrupted. In comatose patient, conjugate deviation occurs to the opposite side as the quick component is controlled by the cerebral cortex which is absent in the comatose patient. There is another phenomenon called doll's eye. When the eyes are on the neck, doll's eye. When the neck is moved upwards or extended, our eyes comes down, and when is neck flexed, the eyes goes up. This is called doll's phenomenon, doll's eye phenomenon, and doll's eye phenomenon is absent in comatose patient. So, these two brainstem reflexes helps in the diagnosis of brainstem death. Thank you.